Heather Gray, the Lyme boss here. I'm a functional diagnostic nutrition practitioner and bioenergetic practitioner. And maybe you feel like crap. And that's why you need to listen to these high-level experts that I have on my show every week, whether it's Lyme disease, mold toxicity, autoimmune, mental health issues, weight, cancer, you fill in the blank. I guarantee you, you will find something inspiring, entertaining, something that'll give you hope, practical advice that you can take home at the end of every episode. I highly thank you for joining us, and you're going to just love this next guest. This one is no different. Like I met Dr. New last year, and it's actually Dr. Neuenschwander, but we call him Dr. New. I met him last year at Lyme Bites at a Lyme conference, and I just absolutely fell in love with his presentation, his heart, what he's doing for kids. And that's what we're going to be talking about today is managing kids with complex illnesses. So let's walk them. Let's walk them, Dr. New.
Well, thank you so much.
Obviously, the podcast host can't talk today. This is going to be fun. Dr. New, welcome. Thank you so much for joining me. I know you're stupid busy, and I just really can't thank you enough.
Well, I really appreciate being here. It's important we get the word out because we've got a lot of kids that have a lot of problems, and it just shouldn't be that way.
No, it's absolutely heartbreaking. Being a kid that was really sick, and then I had my own kid who had his own issues. Like it's heartbreaking being a mother and not knowing what's going on with your kid, and then not having a medical establishment that's actually listening to you either, and they're gaslighting folks. Like it's a whole thing. So I'm glad we're talking about this conversation. So tell us a little bit though, how did you get into working with complex illnesses in kids? Because that's a really tough niche.
I woke up one day and decided my life wasn't complicated enough. So no, my whole it actually goes back to why I went to medical school, and this is my whole backstory. I went to medical school thinking they were going to teach me how to heal people, and as stupid as that sounds now, that's what I thought that they would teach, and they don't. Obviously, they teach about drugs, they teach about diagnosis, they teach about surgery, radiation, that sort of stuff. And I actually went into surgery originally because I'm good with my hands. I was good at it. It's just fascinating for me. I love pathology, all that sort of stuff. But you don't have to get too deep into that realm where you whack out half of somebody's colon because they have colon cancer, and the first thing they're going to ask you is, what do I do so this doesn't come back? And I didn't have an answer for that. They didn't teach me that stuff. And along the same time, my first wife was having some health issues. We tried all the medical stuff I knew, didn't do anything for her. A friend of hers said, oh, you need to go see an herbalist. And she looked up, and this is back in the days before the internet. There used to be this book called The Yellow Pages, and she looked in there for list, honest to God, picks out this guy, goes to see him, comes home. And I remember to this day, I walk in after a day at the hospital, walk in, she's got this box and it's got homeopathics and herbs. And, we're changing how we're eating. We're going to detox. And it's like, yeah, whatever, but like within a month, she got better. And it really woke me up that there's this whole world out there that they don't teach you about in medical school. So that got me out of the mainstream. I learned homeopathy. I learned about detoxification. I learned herbal medicine, and I left my residency.
Woo!
I could have such an easy life now if it wasn't. But no, it's been very, very fulfilling because, immediately when I started my practice, and this is back in 1988, we were using stone tablets and chisels.
I was 10.
Yeah. Irritates me sometimes. But anyway, so 1988, we founded the clinic, the Bioenergy Medical Center is my clinic, but it was founded with the tagline, healing illness at its source. And so I was always looking for what's going on, what's going on, what's going on. So immediately, as soon as you hang out your shingle and say you're integrative, you immediately get people chronic fatigue, fibromyalgia, all these syndromes. And by the way, fibromyalgia didn't exist back then. It didn't have a label. But, you get these people with all these diffuse symptoms. And it's like, well, they don't fit into any of these categories I learned about what's going on. And it took about, I don't know, 45 seconds before I learned about Lyme disease. And it's like, this is in the 90s, the early 90s. I went to my first ILADS conference back in the early 90s. And it's like, oh my God. How many people have this and I don't know about it? Because I went to the University of Michigan Medical School, and they teach you there's no Lyme in Michigan. you could walk in with a bullseye rash holding a tick and they would say, oh, that's not Lyme. Why not? Because you're in Michigan, there's no Lyme in Michigan, right? So, and from there, I mean, you start treating patients, you help them get better. And it's like, oh, you help me. What about my kid? And then
Mm,
all of a sudden, I get rolled into, seeing some of these kids. And then my current wife had a friend who had a kid on the autism spectrum. And, they were chit-chatting and it's like, oh, how's your kid doing? And it's like, oh, he's recovered. And it's like, how do you recover from autism? I didn't know that was even possible. And she said, what'd you do? And it's like, oh, we changed the diet. We went gluten casein free. We did, some detox. We chelated some heavy metals. We did some methyl B12 shots. And she's going, well, that's all stuff new does. And she literally came home and said, honey, you're saving the babies. And, so that's what got me involved with the pediatric part of my practice, which is now maybe 30% of my practice is pediatrics. And it's, again, all the same problems. You have to look at, autism is this label, but what's the underlying cause? And most of the time, it's some type of inflammation. It's some type of brain inflammation. Why is it there? Is it heavy metals? Is it, chronic strep? Is it one of these viruses these kids get? Or is it Lyme? And again, with kids, it's not always obvious, and these kids, they're just the right height. They're the right height to just be tick magnets. So if you're anywhere where there's ticks, they can get them. They get them in their hair, especially because there's no Lyme in Michigan. People aren't looking. They're not doing tick checks at the end of the day. And the kid certainly isn't going to do it, until they go, mommy, what is this thing on my head? It's like, oh,
right.
that's an orange tick that's been feeding for 3 days, so.
You've given me goosebumps like 4 times already in like this short time we've been talking. And I've re-fallen in love with you. Like I remembered why when I watched you because there's not a lot of doctors, right, who are talking like you. A lot of them, even Lyme literate doctors, are still focused on the treatment, the treatment, the treatment, the treatment. And you're talking about bringing in stuff like detoxification and lifestyle and diet. And that's, as a coach, that's how I'm wired. But you just don't hear very many practitioners like yourself talking that way.
No, I mean, even the, when I first went to ILADS, I mean, it was all about antibiotics, right? It was
Oh, it still
stronger,
is.
longer, whatever. And I did that. And I want to say a word about antibiotics just to defend my colleagues. There are people, like if you walk in the door and whether you're a kid or an adult, and you walk in the door and you've had these symptoms for 2, 3, 4, 5 years, and they sound limey, and I do testing and it looks like you have Lyme disease, the odds of you responding to antibiotics, I don't know, 10%, 15%, even the classic patient where you get them within that window where antibiotics should work, I think the number is 40% or 45% respond. I mean, that's pretty crappy. I mean, 65% don't, but 45% do or 35% do. And if you're in that 35%, it can be life altering. So I'll always put it on the table for an adult. Kids, I'm not so sure about, but adults, it's like, look, we can do a month of whatever antibiotic protocol. If it doesn't change your symptoms, I'm not going to keep doing it. Right. I'm not going to go from that to something bigger, stronger, better, longer. I'm not going to do that. But because I've had cases where I cure people in 3 months with standard antibiotic therapy because they've never had it.
Mm,
Right. Never had it. So I don't want to ever take that off the table just because I'm integrative.
right.
Now, you talk
That's the
about kids.
beautiful part about being integrative, though, is that you can, and I didn't mean to like sound demonizing either, but I just have a hard time when people only have one tool in the toolbox and they hit that hammer, and it's just like, no, 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 to heal a whole person, you kind of have to look at the whole picture. And there's so much more going on that a lot of times made them a susceptible host to begin with. And that's the other
Right.
thing
And,
people
and,
aren't
and
talking about.
And even the mainstream doctors, the Horowitzes of the world, I mean, even they understand that antibiotics alone are not going to fix the problem. Even they get it. It took them a couple years, but like maybe 20, but they figured it out because you have to use this as a whole package. Now, when you compare what we're doing with and this is chronic Lyme, this is not, bullseye rash and all that stuff. But when you compare herbal protocols to medical protocols, there really is not much difference when you compare them side by side. right? And I would challenge that if you compare an herbal protocol done the right way, we're going to change your diet, we're going to detox you, we're going to change your environment, we're going to get rid of other toxins, right? You're not going to get better from chronic Lyme if you got heavy metal poisoning, if you're in a moldy environment, if you're eating crap, if your gut's messed up, you're just not going to get better, right? And so when you treat it as a package, I would say the integrative approach is far more successful than the non-integrative approach. And
Can I get an
especially
amen?
so, and especially when you're talking about kids, because I can't emphasize this enough. And I don't know, I think pediatricians have lost their minds. These kids, whatever you do to them is going to affect them for the rest of their life, right? Forever. If you do something to me, I'm 63 years old. I mean, how many more years do I have on this planet? I mean, if God is good, maybe another 30. But if you're 2 or 3 or 5 or 8 or 10 years old, whatever I do to you is going to affect you for the next 80 years. And I can permanently alter your gut with the antibiotics I'm using if I'm not very careful to restore that biome back to where it should be.
Absolutely.
Right?
Absolutely.
Yeah. And that's where all this integrative stuff comes into play. And I think it's essential in any chronic illness, but especially when you're dealing with Lyme disease. Sorry, I talk with my hands and sometimes
I do too. Can't tell you how many times I've accidentally smacked some stranger behind me because I don't know what I would do if you were to tie my hands behind my back. I'm not sure I'd be able to talk. So I feel you, brother. This is a great time. We're actually going to pause for a quick break. Don't go anywhere. We'll be right back.
When you're facing painful symptoms, a diagnosis of chronic Lyme, or an autoimmune disease, it can be overwhelming to navigate. You already know mainstream medicine doesn't have the tools to support you, and often even alternative medicine can become a maze of options without sustained results. Modern living puts significant stress on our systems. To counter this, we need a holistic approach, utilizing the latest technology and guided by physicians with decades of clinical experience. This is biological medicine. The Biomed Center in Scottsdale, Arizona is one of the most comprehensive clinics in the world, incorporating the latest diagnostics available, such as full-body MRIs, computer regulation thermography, heart rate variability, toxin screenings, and along with hormone and gut testing, they achieve the broadest look at all systems of the body. Customized protocols are developed by physicians who have treated thousands of patients in chronic disease by optimizing their biological performance. Save yourself years of suffering and searching with a visit to the Biomed Center, Scottsdale. The future of medicine is here.
EMF rocks, truly rocks. I adore this product. I am very sensitive. Most of us that have chronic illness, especially Lyme disease, are sensitive to EMFs. I can actually run a DNA test to show you if you're going to be sensitive to EMFs. Isn't that amazing? Anywho, I've tried a lot of different products out there, and the one that I have found that works and that's simple and elegant is EMF rocks. You can also get little Faraday cage bags for your cell phones. That's what I put my cell phone in when I am working at the computer. One, it kind of helps me stay focused on what I'm doing and not getting interrupted by my phone, but it also helps mitigate the EMFs coming from the phone. And then I have the rocks with me when I'm working at my desk. I actually have the rocks in bed with me when I sleep at night. And then sometimes if I'm going on long car trips, I'll bring it with me then to help mitigate the EMFs that are bouncing around in the car. Check them out at the resource section on my website. It's thelymeboss.com resource section. Trust me, you're going to love yours and you're going to want to get more. I need more rocks.
Welcome back. Holy shit. The first half of this has already been amazing. And I knew it would be. That's why I chased this guy down. I'm like, I have to have you on the show. Because this is what we do, right? We bring the light, we bring the darkness out of the light. It's funny because I wanted to work with kids just because of my own backstory. And I found it so hard sometimes. Like if you're working with adults, you just have to really have them on board. But when you're working with kids, you have to have both of their parents on board. So now we got 3 people. And I remember my first consult with a woman, and I told her it was a teenager, extremely suicidal, in and out of the psych ward. She was so distraught over her kid. And she was looking into genetics. And I'm like, before you get diving down that hole, let's talk about diet and what's he eating? Oh, the usual pizza and soda and blah, blah, blah. And I'm like, well, first off, he's going to have to change his diet. And she goes, you mean cook for him? And I was like, I thought my head was going to explode. I'm like, yes, well, I just don't know how I'm going to get them off the regular crap. I'm like, who buys the groceries in the house? You know, like and that one experience alone was like enough to put it in. I'm like, I'm not ready to work with kids right now, but I still have a passion because you can change their lives for the rest of their lives and they don't have to suffer and lose 27 years like I did.
Right. Yeah. I mean, the big thing about kids, and I mean, this is the issue with teenagers. I always like to say I never knew more than when I was 18 years old. You just have to convince them. It's like, you don't need to trust me. Just do what I tell you to for 3 months. Let's just draw a line in the sand. You feel like crap. Are you happy where you're at? Because if you are, then you're wasting my time and your parents' money, right? If you're not happy where you're at and you want to change things, this is what you can do. And just do it because I tell you to for 3 months, and then stay on it because it's helping you. Stay on stuff that makes you feel better and forget about the other stuff. And usually you can get them enrolled with that. The trouble really is more parents, because invariably you have one parent that's like gung-ho and the other parent that's, sitting there going, this is all BS.
Right.
If it worked, my mainstream doctor would know about it. It's like, you don't know much about medical education, do you? Because if it's not a drug or a procedure or, some device, your doctor's not going to know about it, unless your doctor happens to be, independent minded and does their own research. But if you're waiting, how do doctors get educated? After you graduate from medical school, that's the last time you're going to get any independent thought. I'm not even sure you get that anymore. But after you graduate from medical school, unless you're reading journal articles, you're all the information you're going to get is going to be from drug companies, and they're not going to teach you about diet, right? They're going to teach you about their latest, greatest drug and how to use it.
I've
Right?
heard that doctors only get like 8 hours of training on diet and nutrition. Was that your experience?
Okay. You gotta quantify what those 8 hours are. All right. So yeah, we got about 8-10 hours of nutritional training, but it was basically, this is vitamin C. If you don't get enough, you get scurvy. And these are the recommended daily allowances.
Oh,
This is
shit.
vitamin D. If you don't get enough, you get rickets. I mean, there wasn't any discussion of nutrition in the way you would think of nutrition as a health coach, or the way I think of it as a physician treating these patients. There's no discussion of that. There's no discussion of the quality of the food, the other ingredients in the food. You talk to a dietitian, a carb is a carb. It could be a teaspoon of sugar, or it could be, the equivalent of a rutabaga, and then consider it the same food, because that's how they look at nutrition. And I'm not talking about dietitians. I'm just saying in general, that's how they're trained, right? And so that's the sort of information we got. And it really had nothing to do with, the different diets and what the diets do and how food can be inflammatory and food sensitivities. And, there's a lot of food sensitivities that aren't IgE, anaphylaxis-based sensitivities. There's all these other, we didn't learn any of that stuff. I always say any of the useful information I have, I learned after my training, right? Not, my training was great for traditional medical diagnoses, so if you're doing the insurance game and you have to put a diagnostic code down, well, it's nice to know how to diagnose, right? So it was very good at that, so the definitions of all these diagnoses, but I really didn't learn much there that helps me in treating my patients now, right? Because every drug I use, almost without exception, is off-label, right? And then necessarily that. And I don't use that many drugs, right? I mean, most of what I do is lifestyle nutrition, herbal combinations, and that sort of stuff. And God bless the naturopaths and herbalists out there, because I'm not smart enough to figure out which ones to put together. So I can now just go to the shelf and pull off, oh, I'm going to do this combination or this combination, because I know that's going to help with whatever's going on with my patient.
Yeah, absolutely. So what would be some of your, biggest advice that you can give parents out there who've got kids, with mystery illnesses that, it kills me how many tummy aches are out there, right? And I think we've just accepted that tummy aches are just normal. And it, no matter how common a symptom may be, it is never normal. So, what are some of these tips that you can give these parents?
I mean, the first thing before you seek out any kind of medical professional, the very first thing is feed your kid real food, give them clean water, and make sure they have a clean environment. I mean, it sounds simple. It's a pain in the butt, right? Because, if you're feeding your kid goldfish or Cheez-Its, I mean, I'm sorry, that's not food. All right, that's garbage. There's no such thing as junk food. There's food, there's junk. And you want to feed your kid food. And yes, it should be fresh. It should be food you make. If you're buying a prepared product, read the label. I always say if there's more than 3 or 4 ingredients, put it back on the shelf. If there's anything on the label that you can't pronounce, put it back on the shelf. All right? Because all these things have preservatives, they have food colorings. Preservatives are antibiotics for the most part, and food colorings, the commercial ones, the FDN-C red number 3 or whatever, those are all toxic. Every one of them's toxic. They're allowed by the FDA because they're in tiny amounts. Well, yeah, maybe you can tolerate the toxicity of one Skittle, but can you tolerate the toxicity of a 1-pound bag of Skittles? I mean, again, sorry, I'm picking on Skittles. I don't mean to separate those out.
These companies need to be held accountable for what they're doing, because our government isn't.
No, it's garbage. And the issue, again, is get your kid good nutrition. And then look at your water. I mean, I still can't believe how many people are drinking tap water from city water supplies. They put fluoride in there, they put chlorine in there. There's all kinds of garbage in there. Get clean water. All right, just get clean water. And then, if you have carpeting, try and get rid of it. Try and put air purifiers in, just things that are going to get clean air inside your house, because the indoor air quality is horrible too. And then just anything you bring into that environment, whether it's clothing or furniture, whatever it is, make sure it's non-toxic. Don't create this toxin-free, organic, beautiful diet and then clean your house with the most toxic crap you can find, or put toxic garbage on your skin or in your hair. All that stuff, it all has to be clean. The other big thing I have, and I'm going to be a promoter here, MAPS. All right, find a MAPS doctor, because it's medmaps.org is our website. It's the Medical Academy of Pediatric Special Needs. These are physicians that are integratively trained to deal with kids. Now, it originally started with kids with neurodevelopmental delays, but it's evolved into treating any kid that has complex illnesses using an integrative approach. And integrative means, yeah, we do use medications if we have to, right? But it's this whole idea, get to the root cause, use whatever tools you have available to get that kid better. So again, we're really working on trying to get enough MAPS practitioners out there. But medmaps.org, we have a current list of practitioners. Find somebody you can work with. My goal is to have one in every town around, because the health of our kids is just done one of these numbers in the last 40 or 50 years. So if the role of the American Academy of Pediatrics or family practice is to improve the health outcomes of our children, they have failed miserably. They all need to be fired. And we need to get people that actually know how to take care of kids, how to improve health, and not just how to push the latest vaccine, the latest drug, the latest therapy, right? It's like we need people that understand health and understand how to get these kids back into that state of health. We have the worst health in the industrialized world.
People don't realize that this is the first time in history that life expectancy has gone down, folks. Don't get me started. So no, that's it's maddening. It's maddening. There were some beautiful nuggets in there, and we're almost at time. So what are some of the lasting little bits that you want to leave with folks before we leave?
Well, I mean, the biggest thing I want to tell people is don't give up. I mean, if you have a child that has a bunch of symptoms and your doctor doesn't have answers to those symptoms, and the answers are not going to be more drugs, just to let you know, if your doctor's only solution is drugs, then you need to find a different doctor. All right. Look at MAPS. I'm not saying those are the only practitioners that know how to do this, but you want somebody who's functionally trained, that understands root causes of problems, that can help your child get well by treating those root causes. There's always hope. It doesn't matter what the problem is. There's always hope for that child to get better.
Absolutely. 110%. How do people find you?
I'm hiding. I'm not going to tell you.
Oh, okay. That's
no.
Wonderful.
I have my website. My office is called Bioenergy Medical Center. So it's just bioenergymedicalcenter.com. We are taking new patients. I'm very booked out. I've got 4 other nurse practitioners working with me. So we're trying to take care of the load we have. And then again, the other The other source of information is MAPS. That's medmaps.org. And again, you want to find somebody that can help your child to heal and get well, not that's going to give you another drug to suppress the symptoms your child is having.
Absolutely. Amen. Hey, and I know that cooking a lot of times is people's like bane and they don't know how. And that is why I created a 9 video cooking series on real cooking for real life, not only teaching you what to cook, how to cook, what to use in the kitchen, because Dr. Dude did say this earlier, that it matters where you get your source of your ingredients from, what kind of pans and glassware and different stuff that you're using, because the kitchen can be a huge source of toxins as well. So I help demystify that and break it all down for you. It's free on my website. You go sign up and go watch and learn how to cook. And yeah, stay tuned. Have a healthy day. Make sure to share the love, like, subscribe, and share. This information is potentially life-saving. Don't keep it to yourself. Make sure to help spread this message. And if you want to experience less pain, have a brain that works, and have more energy, it starts in the kitchen. Download my free 8-video cooking series, Real Cooking for Real Life. No more excuses. Take charge of your health. Start with the free video series at www.thelymeboss.com. That's LYME. Thank you. Have a blessed day.